Thank you very much. I want to talk to you for a few minutes about some of the things that we learned in 2020 and pose some questions so we can all think together about how we can go forward in this year based on those learnings. So WHWB was quite busy in 2020, and one of the things we did was offer a series of webinars or teleconferences on COVID-19. Here are some examples of the presentations that we heard. We offered 12 webinars since last March, including a total of 16 presenters with topics including those that you see here. Now, I'm not going to go through all of this today. I would not have time, but I would invite you to see our YouTube channel if you want to learn about any of the technical information that our presenters spoke about. But today I really want to talk about more what we learned in a social sense and the new meaning that, at least for me, it gave to our phrase without borders. We had been using it in a geographical sense or a cultural sense in terms of national cultures. But I learned a lot more this year about what it means about crossing boundaries of other kinds of cultures, especially cultures of different disciplines, where we have to transcend different ways of looking at things, different terminologies. And we've learned a lot about the difficulties of letting go of what we have been taught, the difficulties other people have, and maybe the difficulties that we have. We've also learned about not letting the perfect be the enemy of the good. I personally have learned that as occupational health and safety professionals, we need to get out of our bubble and collaborate a lot with other disciplines. We've also learned a lot about the politics of these kinds of differences, both big and small. It's reinforced for me the importance of cultural humility, that is not thinking that my own culture, and this is meant in a number of different ways, is the only right one. We've certainly learned a lot about being a virtual community. As WHWB, with all our webinars we've had all along, we knew a lot about that, but we've just explored it in new dimensions this year. We've also learned about some of the inequities in treatment and prevention, and Claudina will be talking more about that. But I want to focus on those ideas of what we've learned by using two examples, one referring to aerosol transmission and one referring to respirators versus masks or other kinds of face coverings. So with respect to aerosol transmission, we've learned a lot about the difference in terminology between infectious disease specialists and occupational health and safety specialists and others, including aerosol scientists, and that the terminology can make a big difference. We've learned that in the infectious disease world, they don't think about things being transmitted through aerosols. They think about them being transmitted through droplets, not a phrase that we are very familiar with, or at least we're not until this happened. At least I wasn't. But we can see that aerosol scientists like Lindsay Marr, whom some of you are familiar with, have been talking about this since the very beginning. Here's a tweet that she posted in March of 2020. And well, our own former president, Kevin Hedges, wrote a letter on behalf of our board to the Canadian government last April, talking about the importance of aerosol transmission. So this kind of disagreement was happening very early in the pandemic, and it came to the fore in July with a letter from Lydia Marowska, who was presented to us, and Donald Milton, signed by 239 different scientists. And we've seen that there has been somewhat of a change since that in terms of the messaging from public health organizations. More recently, we've had more activity on this from more occupational hygiene organizations like the AAIHA came out with a statement on aerosol transmission just last week. And in Canada, WHWB has been collaborating with a number of other groups, including our own occupational hygiene accrediting body, CRBOH, in writing a letter on this to the various politicians and health officials in all our jurisdictions. This collaboration has taught us a lot about working together with physicians, nurses, physicists, ventilation and respiratory protection experts, and microbiologists. And we've learned a lot by working together. And as I mentioned, have been seeing some change in messaging by public health agencies. So what have we learned? Well, I want to think about the difference between what I'm calling an alternative paradigm or alternative, quote, facts, a phrase that's been popularized by our US colleague's former president, and how we should distinguish between those two things. So in terms of an alternative paradigm, I put a little image here of a cut orange, because when I confront this sort of thing, I'm reminded of an experience I had as a mother with a young child when I used to cut oranges or grapefruits for them, and often cut crosswise. So you see the orange looking like the one in the front with the spokes of the wheel. And when my son got a bit older, he went to cut an orange by himself, but not realizing that he had a particular dimension he needed to cut on, he cut it crosswise, and he was confronted with an orange with one central panel down the middle and two sections on either side, and stared at it in great puzzlement, like, why does the orange look like this? It's not supposed to look like this when I cut it. And to me, that's been a kind of a metaphor for different ways of looking at the same thing, same fruit, but if we cut it differently, we have a totally different view. And that might teach us something about how to cross borders, especially in terms of different disciplines. So here's an example of that. This is from the British Center for Disease Control, British Columbia, sorry, not British, British Columbia province in Canada. And they have been one of the organizations especially resistant to acknowledging aerosol transmission. And they posted this recently, and I draw your attention to the second paragraph here, where they talk about smaller droplets. So they adhere to the idea that COVID-19 mainly transmitted through larger droplets, but there's also the smaller droplets, and they're light and they can float in the air for a long time, and people might be infected, especially if there's lack of ventilation. So these smaller droplets sound a lot to us like aerosols, but we call them aerosols, they call them smaller droplets. We certainly kind of link with other disciplines like aerosol science, and we're just been used to calling it aerosols. They don't call this the Journal of Droplet Science. But I'm just wondering whether, is this such a big deal? Is it a different paradigm? Are we going to have a big fight over what you call it, when the main thing is how is it transmitted and what do we do to stop it? So that's one sort of example of, is there a cultural boundary that can be crossed without making a big deal about terminology? But on the other hand, there's the truth. And do we have alternative facts warring here? Again, a phrase with a quotation mark around it. And here we have a factual disagreement. So infectious disease people, and this is an excerpt from something that was published in JAMA, the Journal of the American Medical Association. And they talked about droplets are entities that are more than 5 microns that rapidly drop to the ground with force of gravity within 3 to 6 feet. And as we know, that's kind of the source of the 6 feet distancing that all the public health agencies have been talking about. And aerosols are smaller, less than 5 microns. So that's an infectious disease perspective. And then we have an aerosol scientist. This is Jose Luis Jimenez, who's been very active in this area. And he says that for aerosols of 5 micrometers to fall to the ground quickly, gravity on Earth would have to be 100 times larger than it is, which might happen on some stars, but it's not happening here. So only one of these statements can be true. And this is where maybe crossing a boundary to a different perspective kind of doesn't help us here. We have to confront and we have to agree on what is the truth. So what do we learn from this about interdisciplinary collaboration? Can we break down the borders between different cultures and terminology, but stop when we're talking about alternative facts or the truth? Again, I'm not going to answer that now. There's not enough time, but it is a question, I think, to think about.
The second example I want to talk about is the whole discussion about masks versus respirators. I know that as an occupational hygienist in early days of the pandemic, I was very resistant to the idea of using non-approved face coverings for protection from the virus. Again, as a hygienist, my feeling is that if we're going to protect anyone, we need an approved respirator that has been well fit tested. And along with other public health messaging, at the time, I was not really in favor of masks, wearing masks by the general public. And I've certainly changed my mind, as have those public health agencies. And we've also learned a lot from other countries and cultures in this regard. I've learned that when we're talking about risk reduction of public health, it's not quite the same thing as an acceptable level of protection for workers. And even if these face coverings, be they homemade or be they medical masks, provide 50% or so protection, that is better than nothing. And here we're talking about reducing risks, not getting absolute protection. And this has made me change my perspective, and also made me realize that as occupational hygienists, we have something to contribute to the general public here, because we can say, yes, it is a good thing for the public to wear these face coverings because it does reduce overall risk, but it doesn't provide you complete protection. And I know I have this issue with some members of my own family who think if they put on a mask, then they can go just do what they want because they'll be protected. And there's a lot of communication that has to happen to show people that that is not, in fact, the case, but it doesn't mean that it's not worth doing. So what have we learned from these two examples? Well, we've certainly learned a lot about crossing boundaries of different cultures and paradigms and terminology. We've learned about the difficulties of letting go of what we have been taught. Now, I've certainly learned a lot about how hard it is for other disciplines to let go of what they've taught, but I need to learn that for myself as well. And that's a much harder lesson. But it's a fairly small profession. Occupational hygienists and maybe all OHS people need to get out of our bubble, and we realize we have a lot to contribute to general public messaging, not just to worker protection, as important as that is. We've learned a lot about how it can get political, both in terms of dealing with other disciplines and also on the macro level, dealing with different parties. And with the mask versus respirators, we've learned that there's a different perspective when we're talking about risk reduction in public and worker protection. We've also learned a lot about cultural humility and learning from what other cultures do. So where do we go from here? That's not a question I'm going to answer. I'm going to ask it. Here are some questions for discussion that we will confront later in our breakout groups after we hear from Claudina. So thank you all very much.